Okay, the topic tonight is doctor-patient relationship, and I want to look at the ethical dimension because there are other dimensions to do with doctor-patient relationship. There is the business model, there is the clinical model, but now I want to talk about the ethical dimension. Ssentongo. Some of you know me, I've been the registrar and I've been in this topic for the last 13 years. The context which we are going to address, we can say that the relation can be achieved by a relationship or contact or fulfills the needs of an informed patient. This presentation is based on the principles of the Hippocratic Oath and the Professional Code of Ethics, which is accepted internationally. So the virtues there are beneficence, do the best for your patient. The second one is maleficence. I say at least do no harm. If you can't do anything, at least do no harm. And then confidence. The capacity is patient's respect. Now, what are the basic areas which I can initiate doctor-patient relationship in the ethical dimension? One of the areas that you have to observe in this relationship are the respect of human rights. Unfortunately, in this context of good things, we are talking, don't do this, don't do that. So the respect for human rights is an ethical obligation you shall never violate in your relationship with the patient. Never violate the client's rights of the family, of the caregivers, and all those you are interacting with as you deliver care. You are also obliged in your relationship to desist from any actions that is against the National Bill of Rights, which enshrines the Bill of Rights, of course, which the Ugandan Constitution has also embraced. You are also not expected in your relationship to participate in actions that violate human rights of the clients. And these include people in research which is not authorized, and you take advantages of people's ignorance. I also want to say that you are obliged to report any violation of human rights to your council if you see it. If you don't, and your council came to know about, then you are taken as an accomplice. So the respect of human rights is one of the items that should be listed seriously in your doctor relationship. Second aspect is the respect of persons. This is different. Here you are obliged in your relationship to be non-discriminatory on the basis of even the people who have stolen you. In Western Uganda, there is a doctor. In Western Uganda, there was a doctor who went to punish a thief who had stolen his chicken. And he removed the canyon where the thief was brought to his hospital. And this case was reported to council, and this doctor was registered. And as you have heard, in South Africa, whereas we are used in Germany, we are used to kill patients. So discrimination of any sort not allowed. So no violence against clients, all members of the public. We have cases during their doctor relationship. The price either patients have the female doctors, sometimes they have some funny patients. But all the same, we are obliged in our relationship not to be violent to colleagues, to public. Do we hear each other? Hello? Do we hear each other?
Yes, Dr. Ssentongo.
So this business used to be in the medical school where the senior doctors and the nurses. This one has no position in modern medicine, and it is not among the things that are expected of you in the doctor-patient relationship. Respect of persons also includes to be honest and fair when you are handling clients. So don't get poor patients and you give them poor services. You want to do surgery on a poor person, use unsterile gloves. You want to give free clearance to rich people or people, and you want the poor ones or people of the lower cadre to remain 6 hours in the line. So this is not expected of you in a patient relationship, and this includes billing. Yes. So don't get a patient because he has been dropped by a Benz, then you start inflating the bill where it is not even desired. The third area is the respect for privacy and confidentiality. You are obliged in this doctor-patient relationship. First of all, you have to know that the contract you have is between you and the patient, not relatives, not even the husband. So non-disclosure of client's condition without consent is seriously prohibited in the doctor-patient relationship, even if after death, unless you have express permission from that person. Non-disclosure and privacy is very, very important because so many doctors, I've seen them going to hospitals and asking patients' file because they are relatives. If the patient has not allowed you, cannot touch it, even if you're a doctor. Secondly, let us ensure proper safety of records of clients, because you must not, in your relationship, compromise the privacy and confidentiality of that patient. So the documents about that patient should not be available to partners or other interested parties who are not part of the treatment. And these parties have included now insurance, because insurance is, they've been sniffing around to know the patients, the diagnosis of the patient, so that they can either degrade or increase the premiums. So you have to protect the patient from that. There are also families where they are disorganized families that people want to know, especially if somebody has a terminal disease, to know if they can start sharing property. And of course, partners, we have had partners who really want to know if somebody is going to die, and then they start forgery. So the doctor-patient relationship obliges you to protect the patient's interest, to make sure that other unconcerned stakeholders don't enter into your contract. Of course, there are special conditions where confidentiality and privacy can be broken. If the client is a minor or is unsound mind, or if a disease is of public concern. But this business of going to funerals to tell people how and why somebody died, because somebody is a powerful musician or a serious politician, as a doctor, you have no business with that at all. So doctor-patient relationship, I ensure that you have to keep the privacy and the confidentiality of this patient of yours 100%. The fourth aspect is integrity. Maintenance of integrity in the patient-doctor relationship. This one is related to human rights, but in your relationship, you are not supposed to aid, to support, to conceal any degrading, torture, or violence to clients by the state or individuals. When you take the oath, you take it to protect your patient, not to protect the state or the company where somebody is working. Those of you who are following politics, you heard of the doctor death in South Africa, who manufactured anthrax and was sending to ANC camps in Zambia and Mozambique. So when independence came, they went for him. They went for him and were saying I was receiving orders, and the council was asking him the code of ethics. So there are so many examples here, because we might not have enough time. There are so many examples of doctors who have been brought to book for aiding torture, violence, but he also includes people in the homes who are forcing house girls to take HIV tests without consent, to take a TB test without consent. Okay? So it is big like that. So it can even go to the homes. So don't participate in your doctor-patient relationship in anything that will degrade, will torture, inflict violence on any individual. Not taking advantage of clients. This is basically in research. Some have been doing unauthorized research. People come to make camps here. And that's why when we are in the council, we heard about the medical camp guidelines. People come to provide something good, and they are taking specimen to do research on people who have not accepted. So the doctor-patient relationship does not allow you to take advantage of a patient who doesn't know, because you have your interests that are not allowed. Obtain consent all the way. I'm seeing Dr. Twatarule, who was in the council and was dealing with these cases. Obtaining consent is one of the ways you can maintain integrity of the patient. Gone are the days where a patient walks to your facility and you think he has consented everything. So obtain consent all the way. Somebody came for extraction. Now you find that it needs to be filled. You ask for that consent. Somebody came for extraction and find the surgical operation, which is going to be bigger than an extraction expected. You do that. So don't take advantage of a patient because he doesn't know. Dr. whom I'm seeing on the screen has seen doctors who wanted to do good things for patients without authority, and they ended up in very big problems. You can only do that one in emergency, but in dentistry, we don't have a lot of that. It's basically general medicine. But if there was anything like that, you can do, and then you explain the patient immediately, not the patient find. But in dentistry, there are very few cases that the patient will not know. Maybe those bigger surgeries, in oral surgery, you went in and you found something bigger than expected, but immediately when the patient gets back to life or understanding, then you have to do the explanation. Let us offer effective communication to enable clients get informed decisions. Please promote, under your doctor-patient relationship, effective communication that will enable the patient to make an informed decision. Because some of the patients have refused medication because the communication has not been effective. And if you are satisfied that your information has been correct, respect the informed choices of the patient. You have heard of a patient who had cancer and the doctors wanted to cut off the rail and the patient refused. And then the doctors were quarreling with the patient. Said the patient said, I know it is cancer and it is going to kill me, but I don't cut my leg. So respect the informed choices of your client. If you feel that your counseling and the guidance has not been effective, then you can refer to the seniors where necessary. But respect the informed choices of the client if you are sure that the patient has understood. So don't break the integrity, as you have said, to start doing things which the patient has not wanted because you think he's not well informed, unless it is emergency. The last slide is on access to health services. I think you are aware in your doctor-patient relationship that there is no denial of emergency services to clients. You have heard there have been struggles where patients have been arrested and the bodies arrested. You are asked to provide the emergency services to the client Fortunately, in dental, there are not so many emergencies, except those in oral surgery, but provide emergency services. Most of you are in private practice. Private practice is not for free, and patients should not be expected to get free services. Provide emergency care and refer the patient. Don't keep a patient because you think that they can pay, or don't take advantage of the patient because he has come to be visited by post vehicles. So non-denial of emergency services should not be in your doctor-patient relationship. Let us ensure, because these are basic things, even you, if you have an emergency, you might have money somewhere, but now you don't have it, you need that care. Secondly, let us ensure quality services at all times to our clients. Because you have seen when the health workers get sick, they are asking everybody to make sure everything is sterile and whatever. And sometimes they don't want, so they provide the services that you want to be given to you. The third area, ensure safety of procedures of clients. Yes, the patient, the job you do as a doctor is a very honorable job. A person comes and submits himself or herself to you, and he expects the best clinical outcomes, including safety of life. So in the doctor-patient relationship, one of the things that are expected of you is to ensure safety of procedures on patients. So we don't expect you are doing a root canal, the rumors have gone down the throat and whatever. It is an obligation in your doctor-patient relationship that you have to ensure safety, because somebody has wholesomely offered himself or herself to you. So safety of procedures, safety of life, including safety of properties, because we have had patients who have lost their valuables in our practices. Let us talk about over-service. In doctor-patient relationship, you are not expected to do an over-service. Over-service means you do what is not required. You have been hearing people doing scissors on mothers who can really deliver. For dentists, we can say, don't create a cavity where there is none. Don't create a cavity where there is none. And as doctors who are professional, we are supposed to refer patients where necessary in your relationship, because if really you cannot manage a case X, there's no point of staying with that patient. It is an exploitation, and it is not something that is encouraged in your doctor-patient relationship. Those are the few areas I managed to touch, and the doctor-patient relationship, looking at the ethical dimension, what we are obliged to do to maintain that relationship under that dimension. Over to you, sir.
All right. Thank you very much, Doctor.
Katumba Ssentongo for the presentation. Thank you very much. Members, before Dr. pose any questions, because this is very critical, this guides all our practices. So if you have any question, please ask. Doctor, we have a question. Dr. Katumba?
Yes, sir.
Yes, sir. We have some questions. Yes, are you ready to take some?
You are saying?
Yes, I'll start with someone raising up the hand. Dr. Peter Rock, you can ask when we go to people who have written.
Okay.
You're saying what?
Thank you so much for the presentation. Dr. Peter Rock, I work with the government hospital. Now, my problem is about the government systems. We are using a system, a software, which currently has no access for patient consent. I wonder how this can be solved, because this software has no access for patient consent. So I don't know how this thing can be solved in government hospitals, especially referrals. Thank you so much.
Yeah, that one I can answer straight away. That
Yes, doctor.
any software which does not provide consent is not acceptable at all. I've taken note, but I can tell people who are the council to guide on this. All procedures must have consent. Don't do a procedure which have no consent. You will lose a lot of money. But that is something I can ask council to inform you, so that you can guide your software, manufacturers and whatever. Otherwise, don't do procedures which have no consent. That is very old medicine. Over.
Yes, thank you very much, doctor. We have we have more questions. This one is coming from Dr. Denzi. She said, what do you do if a patient insults you?
If a patient does what?
Insults you. Insult.
Yes. Yeah, that one has happened actually. And patients, doctors have a right actually to sue patients. If patient doesn't pay you, you can sue that patient. If a patient assaults you, you can do that. So they told us of a story of a doctor psychiatrist who sued his patient in Zimbabwe for not paying him. So you are under the constitution, have all the rights. If somebody abuses you, it is a civil case. And it will be really very unprofessional for you to go back to abuse him also, or her.
All right. Thank you very much, doctor. This is coming from Dr. Maria. It is also the same thing. How do you handle aggressive and verbal abusive patients? I think, Maria, they have answered you, Dr. Maria. We can go to another question. What is the opinion of regarding patients asking for procedures like a braces for fashion when they are not indicated for them?
Yes, I've said you do the best you can do for that patient in terms of information. So you are a professional. In one of the virtues for doctors is independence. That's why we say state should not force you to do anything. If you are convinced as a doctor that this is not indicated, don't provide that treatment. because then there is no difference between you and the doctor and the patient. So if there is no indication, don't take advantage of a patient. Let the patient go to the traditional healers, but don't provide something which is not accepted. But if it is fashion, that is different. But if it is treatment, don't provide a service which is not indicated according to you.
Yes, that one is coming from Dr. Antulume. I think they have answered you. We have another question. It is coming from Dr. Puki. Are we under obligation to give emergency service to a patient who cannot afford the service?
Emergency is basically to save life. It is basically first aid. You are obliged to do that. But don't go ahead to keep the patient, because that's what we have been having problem when I was at the council. Somebody came and you really see that he cannot afford, and you keep the patient giving treatments which are not emergency. Private practice is not for free. You are not supposed to treat patients for free. Provide services that will save life and refer the patient to government hospital.
All right. Thank you, Doctor. This is also coming from Dr. Maria. Is implied consent accepted if the patient has paid for the service?
What do you mean by implied consent? Because somebody
Dr. Maria, you can ask the question.
No.
Give more explanation.
The consent, Dr. Antwata already saw many of those. The patient must consent, and it should be with a signature if you want to be safe. If I had time here, I would have told you so many cases I got. Don't trust a patient. That's why we are now calling them clients. A patient is not your friend. If things go wrong, they will deny you. Don't say that somebody has paid, then he has accepted to be what? To be treated like that. If something goes wrong, there are so many doctors who are convinced by their friends to do abortion. When they do abortion, they find that they are twins. They came to council, said, no. I've been looking for twins for 2 years now. You have removed the twins. So if I had time and I have told, because I'm writing a book about all the cases you receive.
You are afraid
300 pages. 300 pages of the cases that we have handled. So don't imply consent to mean that somebody has paid, then he wants a service.
Okay. Doctor, we have another question from Dr. Peter Kawiye. He says, to what extent should we keep confidentiality in regards with insurance companies? Mind you, there is a delicate relationship between clinics and insurance companies.
The insurance company is not supposed to get information from you as a doctor, because you have no contract with that person. The contract you have with the patient. But if the patient had accepted earlier his information to go to the insurance, yes, you have no problem with that. But this business of people coming to ask you what ailment is there so that they can know how to manage the premiums, that is not expected of the doctor-patient relationship. It is illegal and unprofessional and unethical, and you can be sued. Because we have cases here. In that book, you will see the doctors who suffered, who they released information to insurance companies, and then people took them on, invading their privacy, their confidentiality, and the names. Because some of the things, including dead disease like HIV/AIDS. Somebody released the information, and the information went to the whole family and his company. They chased him out of his log farm and whatever. So it can really be big. But if a patient consulted with insurance companies, since insurance companies are becoming smart these days, they're asking people to provide the details and whatever. as basics. If they have it, no problem, but don't be a source. Don't be a source to the insurance, don't be a source to the police. The information can only be given through court order, not by police order.
All right. Thank you very much, Doctor. Doctor, what of are doctors allowed to get patients out of from not in hospital environment outside? Is it allowed?
Doctor doing what?
Dating patients.
Taking patients?
Dating patients.
There's some echo, I don't hear very well. Doctors getting patients from outside.
Doctor,
Hello?
I mean doctors and patients involved in a love relationship, something like that.
Yes, okay. You are not allowed to have a patient relationship, doctor-patient relationship with the patient whom you are currently treating, because it will be seen as taking advantage of the patients. I didn't want to talk about that, but I said don't take advantage of the patients. For the medical doctors, they have been taking advantage of younger doctors or young girls who want to do abortion to force them in love. This is not allowed. But now the books and the ethical gurus are talking about 1 year after separation from that patient, because the doctors want to get married also. So they have been giving a window that if you have handled that patient after a year and there is no additional engagements you have as far as doctor-patient, so a relationship can be okay, but not when you are treating.
All right. Thank you very much, Doctor. Any more questions, doctors? Yeah, we still have some more 10 minutes because we always close at 7. We can ask Dr. Katumba and he guides us. This is very important. Especially as young doctors, please, you ask a question. Whatever you are doubting, as far as doctor-patient relation is concerned, please ask so that they can guide you. Otherwise, let me take this opportunity to welcome the President Uganda Dental Association. Anyway, before that, there's a question from Dr. Daisy. It says, are doctors allowed to pay consultation fees when they come in as patients? I think that's
Good evening, everybody.
Dr.
I think Dr. Katumba has left us, or his device has gone off.
Actually, he has left.
Okay.
He has left, but I think we have concluded. We had finished the questions and he has answered very well. You can have a word to the people.
I think he has joined us again, Dr. Katumba. If you can answer that question.
He has not joined. I'm not saying him.
Oh, I see his this thing there, but yeah, okay.
Yeah, he's using some other the audio. He's using some other number, not this.
Thank you, everybody, for joining us on this special presentation by our ex-registrar, And we really appreciate all of you showing your presence here. And I think there was a great deal to learn from this. And we must be mindful of our ethical behavior in our clinical practices. It was a great evening, and have a good evening to all of you. Good night. Thank you.
All right. Have a nice weekend, members. Thank you for your attendance. Unless there's any question or any guidance or anything. Dr. Antukume, do you have anything to say?
No, sir, I don't have any more comments.
Dr. Puki, you have a question, but the presenter's left. Dr. Antukume, can you answer her?
Answer who, sir?
There is a question that are we under obligation to leave home to treat a patient calling out of working hours and off days?
I think you will be penalized if something goes wrong with that patient and you did not come out to help. But it is, in my opinion, if you cannot come, you should offer the patient a solution. You can let the patient know where they can seek help in case you are not able to come yourself, or at least prescribe something that would help the patient. That is my personal opinion.
Noted, Bob. All right, I think we can close. Have a nice weekend, everyone. Thank you for your attendance.